Is there a reference source for say, for example, a family wants to know how can I avoid some of these things? Is there a website or a telephone number?
Well, there are some people locally that are very involved in this. There's an organization, Local Motion.
Yes.
I think they've probably been on your program before. And they're very involved in looking at the environment from a variety of aspects, but breast cancer as well. And then one of my patients actually has a utterly organic website, and she's very involved in getting the products that may not have chemicals in them.
What about plastics? Is there a relationship with plastics?
You know, probably. Susan Summers thinks that her breast cancer was because of drinking lots of water in plastic bottles that got heated in her car. I don't know that that's been proven, but there are definitely chemicals that leach into the liquids when they get heated, and so we get chemicals that we don't know about.
Maybe environmentally and for safety reasons, we should drink more water out of the tap and out of glasses.
That's right.
Now, along those lines, too, maybe there are some myths associated with breast cancer that people feel there's a relationship with but aren't really true, and maybe you could go over some of those.
Yes, there's a variety of things. People wonder about underwire bras, for instance. There's no evidence that underwire bras cause cancer. There's no evidence that an injury to the breast causes cancer. Sometimes we recognize cancer in a breast after an injury, but it's because of a bruising or it's drawn attention, but the injury doesn't cause cancer. Antiperspirants have not been shown to cause cancer. Some people worry that actually having a biopsy or having a mammogram can let a cancer loose in their system, yes. And that's not true either.
From my specialty, sometimes people ask me, will removing a mole cause skin cancer? And I don't know, there's something about that.
That's right, that's right.
I think an important issue that I'd love to hear your opinion on are the recommended guidelines for getting a mammogram. I think we've been a little bit over the map on that over the past year, and the expert would say.
I think that the guidelines that we had in place before the U.S. Preventive Task Force recommendations, I think 2 years ago, are the ones that I follow. So from the American Cancer Society and the American Society of Breast Surgeons, and actually a variety of societies of physicians that take care of breast cancer patients, to begin having annual mammograms at age 40 is really a useful thing. The task force was recommending considering omitting getting mammograms for women between 40 and 49. And I think we don't have enough data to really suggest that we should do that. And getting mammograms has clearly been shown to save lives. Mortality from breast cancer, the risk of dying from breast cancer is lower for women that get regular screening with mammograms.
That's the good news.
That's the good news. That's the good
Some
news.
of the good news.
That's right. Mammograms are not 100%. They don't always find everything, but they find a lot, and so it's useful.
Along those lines, what other diagnostic tools are available for breast imaging?
There's a lot of interest in getting other kinds of modalities. Breast ultrasound is probably the other very common tool, and breast ultrasound is used in a directed fashion for areas that may be in question, either a questionable mass or an abnormality on a mammogram, and that looks at the breast in a different way and can be very helpful. Breast MRI is a more sophisticated evaluation of the breast and isn't appropriate for all women, but women who are at high risk and dense breast tissue will frequently benefit from breast MRI. And there's some new things on the horizon that are not yet in common use, but whole breast ultrasound. So using the ultrasound to identify all aspects of the breast, not just a targeted area, is something that's being looked at, and procedures are being developed for that. and also tomosynthesis, which is kind of a long name, but it talks about taking a mammogram and getting sort of slices of the breast electronically, not figuratively.
Oh, good.
Getting slices of the breast, much like a CT scan,
Yes.
and evaluating the breast that way is something that's up and coming. It's not yet available really except experimentally, but I think that those might be promising things in the future.
Great. It's always good to have something new as a
That's
new
right.
tool. Dr. Wesen, how would you advise female patients to have checkups with their physician in order to do the best they can to be preventative in terms of breast cancer?
Yes, I think that's important, David. At age 20, women should start having a clinical examination by their physician. Typically, that's the gynecologist, because those are the physicians that women are going to. And then at age 40, unless there are strong family history or other risk factors, to begin having annual mammograms. It's just important to realize that mammograms are not 100%, and even a normal mammogram does not mean there cannot be a problem in the breast. So if a woman has a normal mammogram but feels a change in her breast or a lump in her breast, she should go and be evaluated.
Better to be on the safe side.
That's correct. That's right.
Dr. Wesen, what would you say to the female patient who probably knows she should get a mammogram or see her physician, but has a fear
Yes.
and won't get it because of either a conscious or a subconscious fear? And I'm sure you've run across patients like that.
Very often, yes.
What would you say, or how can you help them in any way by giving them advice?
Well, it is I understand being afraid, and people will say, well, if I don't ask the question, or if I don't know, it'll go away. But that doesn't mean it'll go away. The earlier that we can find a problem, if there's one to be found, the better. The prognosis and the chances of success are far better with early detection. And so I do understand the fear and not wanting to know if there's a problem, but it's better to know earlier. And not asking the question doesn't mean that it changes.
Yes, we find those answers out no matter what.
That's right.
Dr. Wesen, what is the role that a patient's supporting network may play if they have breast cancer? Their friends, their family, their church, maybe therapy?
David, it's really important. A person who has breast cancer is, first of all, a person, and the breast cancer is a part of their present difficulties, but it doesn't mean that that's who they are. And so it's the whole person, mind, body, spirit, that helps them tackle and conquer the problem that they're presented with. And to not understand that the whole person is the one that has to be dealing with the problem, I think is not helpful. It's the support and the love from family and friends, and the cheerful person to say, let's go take a walk because things will be better. That is what people need.
And I think that really is becoming a wonderful part of medicine today.
Yes.
Maybe it wasn't so much years ago, but to treat, really, you are treating a person.
That's right.
And the disease is a part of that person, and it's not compartmentalized.
That's right.
What sort of supportive adjuvant therapies or programs can be available, and what types of things, aside from just the love and support of friends, are available to people?
There are lots of support groups around, and I think that a person should look to find the one that fits them best. We have a young survivors support group, and those are for women who are less than 40, although they're not strict about the age limit. But it's designed to understand that younger women have different needs and concerns than someone who is an older woman. the young woman has young children at home and husbands and working and
Yes.
and maybe older parents, and so
They want to be relate to others who are in
those
their same
concerns are
experience.
different.
Yes.
And then the more traditional support groups that have newly diagnosed women of all ages. There's a new house called Lake House up on Jefferson that is a support project for people to come and spend some time and have projects. There's also grief support, and I think that too often we forget the spouse and the family, but there are support groups
There are
for
patients
those.
too, in a way.
That's right, that's right, and they're the ones that are also hurting, but not so obviously hurting.
Sometimes I'm surprised. Sometimes the patient has so much strength,
Yes.
and the family seems somehow to not handle it as well. Not a criticism, but it's just an observation.
Right, yeah.
Now, what about physical therapy or massage or touching or things like that? What has been shown with that to be helpful?
There's lots to be said about massage and Reiki and Tai Chi, all of those energy improving kinds of processes. And I think for each individual person that may be a different modality that might be most helpful to them. There's art therapy, physical therapy, and in keeping activity going even during treatment has really been shown to be helpful in the treatment. We have a physical therapy department that actually has some physical therapists who are specialized in cancer treatment, and they know to modify the activity according to the capabilities of the patients. But cancer fatigue is often improved by having physical activity, and we know that physical activity helps with the psychology of feeling more comfortable about things. And so there's lots of things that can be done well beyond the medical and surgical aspect of care.
Dr. Wesen, following up how you started out our conversation, we don't want to also forget that men too can get breast cancer.
That's true. Yeah.
And so let's just all be aware of that too.
We don't want to forget the men.
Don't forget the men.
That's right.
Now, how would a person be able to contact you or seek your services?
Well, my office is in the Van Elzender Cancer Center, right adjacent to St. John Hospital and Medical Center on Mack Avenue. And my phone number is 313-647-3900. I'd be more than happy to answer any questions. There's also a website, the St. John Breast Care website, that is a great source of information about breast care, and that is stjohn.org/breastcare. And hopefully those will be resources for patients.
That's great, that's great. And sometimes I think people like searching a website because it may be in their comfort zone to
That's
get
right.
them started on the exploration process.
There's a lot of information out there, sometimes an overwhelming amount of information.
It's important to get the correct
That's right.
information.
Don't Google on breast.
No, yeah, I agree. Well, Dr. Wesen, thank you so much. You've been very insightful, and this is, I think, a great program for October and Breast Cancer Awareness Month.
Thank you so much for
coming on the
inviting
show.
me. Great.
And thank you to our viewers as well. As always, we appreciate that you tune in to watch our show. And take good care of yourself and those around you, and have a great day. We'll see you next time.